and I'm getting the same message that I'm having internet issues. New phone company. So I'm not sure what's going on with that. My little bars look good, so I don't know what's going on. So I apologize. I'm going to try ignore those little flashes that come up because it really puts me off my game. And we had them quite a few last week. And when I went back and watched the replay, it looked fairly cohesive. So we're going to just say that. Now today, we're going to talk about hormones, hunger hormones, particularly as it relates to blood sugar metabolism. So I saw this on a friend's post on Facebook and I thought, oh, I didn't know that. And so I felt like I needed to know more about it. And you probably don't know either. And so we're all going to get smarter together, okay? So the post was, Venom from a lizard known as the Gila Monster contains a hormone that shuts down its metabolism so that it can live without food for long periods of time. That hormone was synthesized and then patented as semaglutide, which is also known as Ozempic. And then the post goes on to know, do you know what this does to the human body? And so most people don't. So the origins of Ozempic, it is not made from Gila Monster venom, but it was inspired by that compound that is found in the venom. And the native of this little Gila Monster is a native of the southwestern part of the United States and in Mexico as well. So we may have it, I just don't know about it, okay? So the key components of the drug are Exendin 4. This is a specific compound derived from the Gila Monster venom, and it is called Exendin 4. This peptide mimics a hormone in humans known as glucagon-like peptide 1, or GLP-1. And we do see that on the ads and different things, GLP. I didn't know what GLP stood for. I'm not one that likes medications. I don't usually research medications. When someone comes in and they say they're on XYZ medication, I tend to look it up and see what they're doing. But I couldn't have told you. I knew what glucagon was, but the GLP, I wouldn't have been able to tell you. So this particular enzyme from this lizard mimics or is similar to what goes on in the human body. Now, the hormone in the human body helps regulate appetite and blood sugar levels. So the synthetic development, the scientists synthesized this compound to create longer lasting versions that can be used as medication. And this led to Ozempic and Wegovy. Now, the functionality of this is for weight loss and type 2 diabetes. So it was really developed for type 2 diabetes. People did lose weight, and so the doctors did off-label with this. And so there are clinics set up all across the land that all they do is give you the prescriptions for this medication. So this works by signaling the pancreas to release insulin and helps the brain regulate feelings of fullness. While Ozempic does not directly look like or made from the Gila Monster venom, its development was significantly influenced by the unique properties found in the venom. Now, millions of Americans are taking this popular diabetes and weight loss drugs. They may face double risk of developing vision-threatening eye conditions. Okay, and this is according to some new studies. So we're going to be talking about some different things that these drugs do, and then I'm going to show you a healthier alternative because all of us need help in managing our blood sugar. While we're diabetic or whether we're not diabetic, it really doesn't matter. The food supply that we have today is compromised. It's not healthy. And so with all the different additives and sugars that are not sugars, or I should say sweeteners that are not sugars, we all have problems. And so this is something that we want to address because obesity, which is a blood sugar issue, is something that 1 in 3 of us faces, okay? 1 in 2 of us is overweight, okay? Every other person is overweight. 1 in 3 of us is obese. If you are obese, your risk of getting diabetes is more than doubled. If you are obese and have diabetes, your risk of getting cancer is quadrupled. So if we can do anything to manage our blood sugar, we really need to, because this is really, really important for long-term health. All right, this study tracked more than 1 million patients over 3 years. In the research published by JAMA, Journal for American Medical Association Ophthalmology, found that patients taking GLP-1 antagonists, which is Ozempic, Wegovy, and Rybelsus, we all know those names from the TV commercials, right, had more than twice the risk of developing neurovascular age-related macular degeneration. That's a lot of words on that. It's better known as wet AMD, age-related macular degeneration, which is a leading cause of blindness in older adults. So there's dry and then there's wet. So the macula, here's my little eye. The macula is way back here at the back of my eye. When you come in and I do iridology exam, I don't see anything except the iris, the colored part of your eye. But when you go to the eye doctor, you're in the way back of the eye there, they can look at the macula. When they're looking at the macula, they can tell whether you've got age-related, wet, or dry. We don't want to have any of that. Not any of that, okay? So when you're on these drugs, it doubles your chances of getting these drugs. Now, it is a relatively low risk because age-related macular degeneration does not affect everybody. However, okay, roughly 1 in 1,000 additional users of this drug may develop this condition. So it's going to double. With millions of people taking these medications, it affects thousands of people. Research analyzed the health records from Ontario, Canada, involving more than 1.1 million patients aged 66 and over with diagnosed diabetes, and tracked them from January 2020 to November 2023. Now, the primary outcome was new cases of age-related macular degeneration identified through medical billings associated with eye injections used specifically to treat this condition. Patients were followed for 6 months after starting GLP-1, and they developed, or until they developed the disease, the macular degeneration, or until they died. Oh my goodness. We don't want to study people until they die. We don't want people dying, okay? So this was a 3-year study. The study found that the longer the use of these GLP drugs led to progressively higher risks of developing wet age-related macular degeneration, suggesting a dose-response relationship. The more you take it, the worse your condition's going to be. So what is wet age-related macular degeneration? So the macula degenerates, it falls apart, it's not cohesive, it doesn't hold together. When it's wet, you get a lot of bleeding on the inside of your eye, okay? And so you don't want that bleeding because it messes up with your vision. And so they give you shots in your eye to dry up the blood or dry up the blood vessels, whatever they do with that. And so we do have supplements in here. If this is you and you're having to do that with your eye, we do have supplements that have extended the time between injections. So I don't know that I would want people injecting stuff into my eye. Just going to say that. But we do have proven help and support for that. Okay, so the people that use these medications, GLP-1s, for 6 months to 18 months had double the risk, while those using them for 18 months to 30 months saw their risk more than triple. The higher risk was among patients who used the drug for more than 30 months, who faced nearly 4 times the normal risk of developing sight-threatening conditions. Wet macular degeneration is caused by abnormal blood vessels growing under the retina, causing swelling, bleeding, and scarring that can lead to vision loss. It causes faster vision loss compared to the more common dry macular degeneration, although it is treatable if it is caught early. And this is why us elderly people need to go to the eye doctor every year. I know it's an inconvenience and all that kind of thing, but really we need to do it because there's so many things that can be happening behind the eye, inside the eye, that you don't have any symptoms for until it's too late. So we definitely want to do that. We want to make sure that we go to the doctor. So there is excellent treatment for age-related macular degeneration, but we know we don't want that. All right, so the GLP-1s add the increased risk of macular degeneration. All right, so why is that? Because increase in blood sugar is what causes diabetes. The GLP-1s rapidly reduce your blood sugar. Okay, and this is according to Dr. Brian Vanderbeek, who is Associate Professor of Ophthalmology at the Hospital at the University of Pennsylvania. This leads, the low blood sugar, the drop in the blood sugar, leads to an insufficient supply of oxygen in the retina, which triggers the production of these blood vessels, okay? So we don't want to do that, and this is the mechanism by which things happen. And so this is what most people don't understand. When you're taking a drug because you have a condition and you want a quick response. I get that. Nobody wants to be sick. Nobody wants to feel bad. Nobody wants to change their eating habits, right? We're just saying that. But if you don't, or if you just rely on medications, then you're going to have all these side effects. And the side effects are sometimes worse than the original condition. So, we want to make sure that we don't do that. So there's a Dr. Jovi Bopare, I may not have said that right, apologies if I misspelled your name. It is important to highlight that this was a retrospective study and only showed association, not causation. Now, this doctor is an ophthalmic surgeon, and he is the co-founder and CEO of Cornea Care, and he was not involved in the study. There's another concern about using these medications is that it can cause you to go blind with non-atrophic anterior ischemic optic neuropathy. Say all those words really fast, right? And what this means is that there is a swelling of the optic nerve, which damages the optic nerve, and it causes rapid vision loss. So in a retrospective study in JAMA, noted that the risk is smaller than previously reported. So they reported one thing and then they went back and they looked at different data and all that. And you don't know why they go back and retrospect these things. And it could be pressure from the lobbies. I mean, this is one thing that we found in our research. A lot of these experts are being paid to say what the developers want them to say. And so we really need to search really deep and find out, do these people have a conflict of interest, or, are they really telling the truth based on unbiased, evidence here? So they do say that more research is needed, and it is something that you need to watch out for. So if you are on GLP-1 medications, it could damage your vision, all right? Diabetes damages your vision. If you don't take care of your eyes, if you don't take care of your sugar, right, then you can lose your limbs and you can also go blind. And so we don't want to be doing that. Now, medical experts stress that you should not just suddenly stop taking these medications without your doctor's advice. Diabetes and obesity carry serious health risks of their own, including diabetic blindness. Vanderbeek noted in a commentary that the findings highlight a new potential concern for individuals taking GLPs and emphasize the importance of scrutinizing the safety profile of these widely used medications. Now, this is one thing that I do find. I do find that clients who come in here to seek a holistic, help for their problem, whatever that problem is, I will ask them about their blood work. They don't know what it is. The doctor called them, they had their blood work, and their blood work is fine, but they've never seen it. That's not a good idea. You need to see what your blood work is, because I'm telling you, when I have asked people, did you know that you have XYZ or your whatever is out of range? No, my doctor didn't say anything about that. Well, no, they're not going to, because you're not in far enough out of the reference range that you're going to be needing to have medical intervention. What we want to do holistically is turn that around so you never need medical intervention. All right, so you need to know this. We also have clients that are on medications. They never read the patient information insert, and this is something that we must do. Why? Because we want to make sure that we're not having any kind of black box warning. And these medications do have black box warning. Now, a black box warning is the strongest warning that the FDA allows on prescriptions, and you really need to take it very seriously, because they're only putting it on there because they don't want to be sued if this happens to you. That means this is not just something they decided to put on there for their health. This is something that you need to know for your health, okay? And so people need to be working with that. There's a doctor, I'm going to say this name, Agwal, who is an optometrist, and she is the host of the podcast Uncover Your Eyes, and she is the owner of 3 eye care practices in Canada. And she says it is important not to panic over these findings. Now, she was not involved in this study, and she said that while the study adds a new consideration to the conversation around GLP-1 receptor antagonists, these medicines are still very effective in managing type 2 diabetes and obesity, which are conditions that carry serious risk, including blindness from diabetic retinopathy. So, retinopathy, the retina has a sickness, has a disease, has a pathogen, that kind of thing. We don't want to do that, and I don't want anybody to go blind. She said that the concerns about the study findings is important enough that you should speak to your physician and you should have annual exams. The goal is not to stop the treatment abruptly, but to evaluate the overall risk and then consider appropriate monitoring. So I'm just going to say obesity and diabetes are both preventable diseases, okay, especially type 2. If you regulate your carbs to no more than 90 carbs per day, you can pretty much reverse your diabetes, all right? This is something that nobody ever tells anybody about. I'm on Facebook groups on diabetes and different things, and the doctor says, take this pill, take this shot, but never gives any kind of information about what foods are to be avoided or however many carbs to have at a meal. So if you only limit your carbs to 30 carbs per meal, you pretty much can work yourself out of diabetes, and you can work yourself out of obesity as well. So I know there are some very rare instances where there is a genetic component, but honestly, it's the poisons in our food supply, all right? So we've got to stop eating the things that are not good for us. In fact, funny story, last night, Thursday night, we're open late till 6 o'clock. And so, it's like, what are we going to eat? I don't know. Let's go down to James Coney Island. Now, y'all know, because I've told you I don't eat pork, right? So I get the all beef hot dog, right? But I don't eat the bun either, all right? So I'm finishing my hot dog, and I don't know if he's the owner or the manager or whoever came over and said, can I ask you a question? I said, yeah. He said, was there something wrong with the bun? I noticed you didn't eat the bun. I said, oh, no. I said, I never eat the bun. I said, I don't eat bread because bread is contaminated with glyphosate and different things. And, I don't tolerate it well, so I choose not to eat it. And he looked at me and he said, you're right. He said, I changed my diet and cut out all the bread, and I lost an enormous amount of weight. I said, yeah. I said, that's because of the way it's processed here in the United States. And we went on to talk, and I said, sometimes if I go to this special place that has this special yeasty warm bread, I may indulge in that. And he started laughing. He said, yeah, me too, maybe twice a year. But he did say that when he had stopped eating contaminated food, he had lost a tremendous amount of weight. And so this is what we need to know. We're not necessarily overeating. We're just eating food that is not food, or food that has been contaminated. So, people all the time tell me, well, Jesus ate bread. Yeah, I know. But the bread that Jesus ate was not the same kind of bread that we have today. And so we have to just be mindful of that, because we want to make sure that we are not obese and we do not have diabetes. So this is important. There are other things that can happen from taking these drugs. Muscle, bone, and hair loss are reported by those taking these GLP-1s. Rapid weight loss and improper nutrition can also cause these issues. The way to counter all three problems, the experts say, is to eat a high protein diet, exercise regularly, particularly through strength training. And this is something that we older women who are postmenopausal, we need to do exercises and we need to do weight bearing training so that we strengthen those bones, okay? So muscle wasting in particular can result from malnourishment. What is malnourishment? Malnourishment is you're not getting the nutrients that you think you are. And I will just tell you, if you are not taking a really, really good vitamin, you are malnourished. Why is that? Because the food that we have in this country does not have the nutritional density that we are used to. And this is why twice a day, I do this twice a day. Why is that? Because these particular vitamins are formulated for seniors. They break down into nanoparticles so that if we have an impaired digestive system, which 90% of the people that come in to see me do, that our body still has the ability to absorb these and to make use of them. In fact, we even guarantee, the company, not me, but this company guarantees that if you take these vitamins twice a day for 90 days, your score will improve. Now, I just want to take a minute. I didn't know I was going to be talking about this, but we're going to take a minute. I'm going to show you something. I've shown you this before, but we're going to do it again. So this is a, what? This is a scanner score, all right? Right here in the orange. It should be over here. That's my pretty husband. That's not what I wanted to do. That is not what I wanted to do. Okay? We want you to be over here in the purple, all right? And the people that measure this, and we want to measure, we can take a whole basket full of supplements, but if you can't measure how they are working, then you just don't know. You take them, you hope they work, you're doing your best you can, and that's it. However, with Pharmanex vitamins, we can do this. We can measure it, we know what we're doing, and after 90 days, you come back and scan again, and your score will be closer to the purple, or you get your money back. And so they've never, this has been since 1999. I think it's when New Skin bought Pharmanex. Pharmanex has never had to refund the money, because if you take it the way they tell you to take it, it is guaranteed to work. And so this is the reason I take these vitamins, because the components in your body that fight sickness and disease and aging are called carotenoids. You get carotenoids from eating fruits and vegetables. You need to eat 36 different fruits and vegetables every week to get all the nutrition that you need from your food. Nobody does that. I don't do that. I don't know anybody who does that, okay? But because I take vitamins made out of fruits and vegetables, I am covered on that. And so I'm not going to be suffering from malnourishment. Now, when you're on these GLP inhibitors, you are more likely to be malnourished, because that enzyme turns off the hunger because of what I said earlier about how it mimics that hormone. We feel satiated. We don't feel like we need to eat. We're not hungry. And so that's why you lose weight, because you're messing with your metabolism, but you're messing with your metabolism in a bad way. this doctor says that GLP-1s can lower the appetite so severely that people starve themselves into muscle loss. People who are very active while being on these drugs, who are doing strength training and eating enough protein, report that they are gaining muscle. Now, this is according to Tina Moore, who is a naturopathic doctor and an expert in GLP-1. She says other people, the decrease in muscle size could be because of the loss of the fat marbling inside the muscle, which makes the muscle size shrink. Another issue, and this is on the label, is that you can have gallbladder issues and pancreatitis. So slowing down the digestion, which is what this enzyme does, creates a sluggish gallbladder, and gallstones can get logged in the pancreas, causing pancreatitis, swelling, and pain in the abdominal region and sometimes the back. Now, this is already something that people with diabetes are prone to, but this is the thing. Pancreatitis is a precursor to pancreatic cancer. So nobody wants their pancreas to be inflamed, and this is what this does. The black box warning says that these GLP-1 medications warn against thyroid cancer. And when you're watching the commercials on late night television, and yes, we do that sometimes, it does say that you want to be really careful against medullary thyroid disease, and if that's in your family, you want to avoid that. So what is the option if you don't want to do drugs? Well, we talked about this last week, but we're going to talk about it again, and it is M-Smart. All right, M-Smart. M-Smart looks like this. It's a powder. You put it in water. You shake it. It tastes kind of like iced tea. It's not sweet, sweet, sweet like we like it down here in the South, but it does taste like iced tea. You can put it in lemonade, you can put it in apple juice, you can do whatever you want to with it. But what does this do? It balances your blood sugar so you don't have those highs and lows. It helps you to metabolize the carbs like you are supposed to. So remember when I said that I don't eat bread because my body doesn't metabolize the carbs right? I gained weight on that. Yeah. This is why we do this, because this helps metabolize the carbs appropriately so you feel full, you're not hungry, your apostat, okay, which is in your brain, it's not telling you to eat everything in the world because it's got that nutritional deficit that causes you to be so hungry. So you do this 30 minutes before your meal, and it gets in your system. And then when you take in your meal, it helps you have a healthy response to the carbohydrates that you eat. You're going to find that your energy does not, spike and crash. You're going to find that your blood sugar does not spike and crash. And so you're not going to have to worry about going blind, losing your hair, wasting away with your muscles, having bone issues, all the things that these GLP-1s do. So, healthy alternative. We have this in the clinic. Everybody that has tried this has absolutely loved it, loved what it's done for them, loved it the way they feel. I do it every day. Okay, you can do it up to twice a day. Part of that is because they want you to make sure that you're eating, right? We don't want you just relying on a supplement. This is not a meal replacement, okay? It just helps you have a good response to the carbohydrates that you take. So, what are we going to do to manage our blood sugar? We're going to be smart. We're going to be M-Smart, okay? The M stands for meal. So you want to reach out. You want to get this. You're going to see some huge, huge changes in the way your blood sugar responds. And so if you're a diabetic, if you are someone that loves carbs, but you have those highs and lows, you're going to want to do this. Is this something that heals you of diabetes? No, it does not. Okay, it does not do anything except manage your blood sugar, help manage your blood sugar. And this is what we all need because we all eat junk food from time to time. We all eat contaminated food because that's just the way our life is right now. And so we need to have M-Smart so we can metabolize our carbs appropriately. It is the weekend. What does that mean? Rest, recover, renew, rejuvenate. All those are words, okay? Thank you for liking. Thank you for sharing. Thank you for commenting. I appreciate all that. And I will see you next week.